Our particular transformation, we went down the journey of creating a patient-centered medical home. We want to take it one step further and create what we call the virtual patient-centered medical home. And we did this in 5 steps, and I want to kind of run this through. The first thing you absolutely must have is data. Okay? The new model of healthcare is based on information. You want information right where you're treating patients, all right? Whether the patient's in the grocery store or at the beach, wherever they are, you and the patient need to have information, right? So this entire transformation doesn't work unless you have the data. So when you talk about doing a statewide provider database or doc books, any of these tools that help you know what's going on with your ship are going to help you be a better captain, okay? So once you've got some sort of tools in place, it may be a combination of tools, all right? We used an integrated EMR solution that pulls all of our docs together, all of our nurses, every doc, every nurse, every patient on the same system. We can all talk to each other, we can all see the same chart, we can all view the x-rays, we've got all the information anywhere we need it. Got it on my iPhone, got it on my iPad, wherever I want, okay? This is really transformational stuff. Then you've got to go to the next layer. The next layer is shared clinical protocols. This can be tough. This is agreeing to practice medicine the same way, all right? I'll give you an example. We put all our GI guys in one room and says, you guys can't leave this room until you agree to use one colonoscopy prep, because it's driving our patients nuts. Every one of you is using different instructions. Some are on Go Lightly, some are on, magnesium citrate, whatever. Our nurses can't keep it straight, the patients can't keep it straight, the pharmacists can't keep it straight. You guys can't leave this room until you agree on one colonoscopy prep. And they did it. I think it took them 12 hours. but seriously, when you have to do this rule by rule and layer by layer, and agree with, at least in your practice, that you're all going to try and standardize a lot of your care. Because this will dramatically improve the quality you give your patients, and I'll show you how and why. Once you've got some sort of rules in your system, you need to find out if they're actually working. Okay? So you need to do the next layer, which we call our, we have the rules and tools, and then we've got the reporting and rewarding, basically. Reporting incentives. You need to be able to look at some kind of report that tells you where your ship's headed. Okay? And ideally, you want your payment to be tied to that. So these new payment models are really important. You can't really fund a lot of these changes through fee-for-service medicine. That's one of the big problems we face. I'll talk about that. All right, the next layer we went to is team care. Quality is a team sport. All right? The idea of solo practice, of a single person being completely responsible for another human being's health in this complex day and age is ridiculous. Okay? It really is. It doesn't mean you cannot be a solo practitioner. You can still be financially independent. There's no problem with that. But we need to be more interdependent. And that's why organizations like this are so critical. We'll talk more about team care. And finally, the most important part is the true patient-centered approach to healthcare. What does that really mean? Okay? This is truth versus fiction. Is that a movie? Is that Star Trek? What does patient-centered care really mean, and how do you deliver it as a healthcare provider? The reason we call this the virtual model is the teams don't have to be present in the clinic. They could be anywhere. You can build this team working with other providers. Okay? They can service multiple clinics. You could work with your insurance company to create a model like this. But the team members must have the trust and permission of the primary care providers. Okay? This really works when they can call and say, I'm calling from Dr. Glenn's office and he would like you to get a mammogram. Okay? I'm calling from Dr. Smith's office and she sees that you're overdue for your pap smear. Okay? Can we get you in for that? That's when it works, because as we said yesterday, you cannot replace the doctor, because that's who the patient has chosen. You're the captain of their ship. They wanted to cruise with you. Everybody needs to work under your authority because of the trust. That's what's important. Okay? So, and they have to be allowed to act independently. All right? You have to have protocols that you trust and they trust, where you can let them do their job.